Hi, today I'm going to talk about force-fed schizophrenia. There are three different kinds of force-fed schizophrenia. Today I'm going to talk about the first one, and I'm selecting it as the first one because it's the first one that I encountered in my life. As I was growing up, I would hear stories about friends of my mom's who had children, girls for the most part. I never heard this happening to a guy, but the daughters that were problematic, they all seemed to be labeled with a diagnosis of schizophrenia, and they were never around. You never got to see them. I also heard from a friend who I knew as an adult in recovery. She had a daughter who had a drug problem, and she also labeled her daughter as a schizophrenic. So in my observations as a psychiatric nurse practitioner, people who use drugs often develop the symptoms of psychotic disorders that look like schizophrenia. So a person who floods their system with dopamine by way of illicit drugs, they're going to exhibit symptoms of schizophrenia, which means they're going to sometimes they might have visual hallucinations. That's not very common, but primarily auditory hallucinations are very common, and psychotic thinking, psychotic behaviors. But when you take away the illicit substances, the person's symptoms of psychosis disappear. But what happens, I guess, after years of drug abuse, the person will, I guess, exhibit symptoms one too many times, and they will ultimately be labeled as a schizophrenic. So I think that that is what happened to the people that I had heard about as a young person before I became a nurse, because I knew that each of the people involved had been involved with drugs at some point. And schizophrenia is generally uncommon. It happens, or it's expected to happen, with 1 out of 100 people for the most part. And we're talking like the bell curve. So when you look within the bell curve, I'm not talking about special circumstances. When you fall within the bell curve with like regular schizophrenia cases, the 1 in 100 people, usually they'll develop symptoms towards the end of high school or in the beginning of college, right around the time they're transitioning into adulthood. And it's really tragic because that is when a person's life is starting to blossom, and they're spreading their wings, encounter the world as an adult. And it's very tragic. And there's three phases that occur. There's the prodromal phase, and that is usually misdiagnosed as depression or just a lot of isolation. Then there's a psychotic break, the acute phase, and that's usually when the person ends up in the hospital with a diagnosis. And then there's aftercare. And schizophrenia is a chronic illness like any other, and it can be managed successfully in the community with the right support. So that's my first episode talking about what force-fed schizophrenia is. There's two other types. I will be recording videos about those as well. Schedule with me to learn about how to sharpen your NP skills, and it's by working with the most difficult patients that we're able to manage our regular day-to-day patients.